Right. So this is parotid gland. Where it is located? It is located in its mold. What is its mold? Parotid region. Parotid region is bounded anteriorly by what? What is this? Ramus of the mandible. Okay. Posteriorly by what is this process? Mastoid process, styloid process. Then above by what? Here, this is external acoustic meatus. External acoustic meatus, and also one joint is present. What is the joint? Temporomandibular joint. And below you can see posterior belly of digastric. Able to see the posterior belly of digastric. If you can't, just come. See, this is posterior belly of digastric. Right? So this region, what we are calling parotid region, or we can also call it parotid mold. Right? Within the parotid mold, parotid gland is located. Right? Now, this parotid gland is inverted pyramid or three-sided pyramid. This gland is three-sided pyramid. What does it mean? It is having the apex. This is apex. It is having base. Here is the base. It is having anterior border. This border is anterior border. And here, this is the posterior border. Right? So, if there are three borders, definitely there will be three surfaces. Right? So, in between the anterior border and the posterior border, what is this surface? This surface what we call superficial surface, we can also call as lateral surface. This surface what we call superficial surface, we can also call as lateral surface. Right? Then there will be medial border also here. This medial border will be very deepest. Unless until you remove the mandible, you cannot see the medial border. Because it is in relation with the pharynx. That's what that border what we call? That border what we call? That border we can also call as pharyngeal border. Okay? That border what we call pharyngeal border. Right? So anterior border, posterior border, pharyngeal border. Right? In between the anterior border and the posterior border, this surface is superficial surface. Then in between the anterior border and the medial border, what is this surface? See here. This surface. This surface is anteromedial surface. Are you able to see? No? Come that side. This surface. Okay? This surface is anteromedial surface. Right? Then, in between the posterior border and the medial border, what is this surface? Posterior-medial surface. In between the medial border and the posterior border, this surface what we call posterior-medial surface. Right? Now, we know the different presenting parts. We know the apex is here. We know base is here. This is the anterior border. Here is posterior border, and the medial border present medially. That border we can also call as pharyngeal border. And there are three surfaces in between the anterior border and the posterior border: superficial surface or lateral surface. And in between the anterior border and the medial border, this surface what we call anteromedial surface. Then in between the posterior border and the medial border, this surface what we call posteromedial surface. And this is base, and here is apex. Base we can also call as superior surface. Some authors they will tell that it is superior surface. Right? Now we know the presenting parts. If you know the presenting parts, now we have to discuss what are the different relations of these presenting parts. What are the different relations of presenting parts? Right? Now we'll see what are the relations of different presenting parts. First we'll take apex. This is apex of the gland. Is it? This is apex of gland. Apex of gland is related with, what is this nerve here? See here. This one. This nerve is cervical branch of facial. This nerve is cervical branch of facial. Next, what is the other structure? It is present in relation with the apex. See here. What is this? Retromandibular vein. This vein is retromandibular vein and its anterior and posterior divisions. Retromandibular vein and its anterior and posterior divisions. So these are what? Relations of apex. Right? Now we will go for relations of base. This is the base. If it is base, what relations are present? From anterior to posterior side, see here. This is base from here to here. If it is base, what is this structure? See here. This is the branch of facial. Okay, this branch of facial is going to the temporal region. Okay, and temporal branch of facial, and it is supplying to the, what is this muscle? Frontal belly of fronto-occipital. So what is this? Temporal branch of facial. What is this? This is the artery. Superficial temporal artery, superficial temporal vein. That is superficial temporal vessels are these. These two are the superficial temporal vessels. Right? Then, what is nerve here? There will be one nerve, this nerve. Okay? Auriculotemporal nerve. So these are the relations of base. Very simple. From anterior to posterior side, temporal branch of fascia, superficial temporal vessels, then auriculotemporal nerve. Right? So these are the structures which are in relation to the base. So now relations of apex over, relations of base over. Now we'll see the relations of anterior border. Anterior border relations are, see here, from here to here, this is the anterior border. So what are those relations? See, from the anterior border, see this nerve. What is nerve? Marginal mandibular nerve. Okay, actually, if you observe from the posterior medial surface, we can see the nerve here. This nerve, can you see? This nerve, are you able to see this nerve? Yeah. It is emerging in between the mastoid process and styloid process. That means through the stylomastoid foramen, this nerve is emerging out. Once it is emerging out, it passes through the gland and it divides into 5 branches. Okay, cervical we have seen. Then here is marginal mandibular. Then here buccal, actually buccal will be divided into upper buccal and lower buccal. This is lower buccal. Okay, and it is upper buccal. In between the upper buccal and lower buccal, you can see the duct here. Parotid duct. Right? So of course there will be transverse fascia also that we didn't trace. Right? So transverse facial artery. What is this? Marginal mandibular, lower buccal. This is lower buccal. Okay? And here is the parotid duct, and here is upper buccal, and this is the zygomatic branch. Right? So these are the relations of anterior border. Anterior border relations. Clear? So now we have completed anterior border relations also. Should I repeat it? Marginal mandibular, lower buccal, parotid duct, upper buccal, zygomatic branch. Right? Don't write temporal, because temporal already have written in relation to the base. Right? So that is about the anterior border. Then coming to the posterior border. This is the posterior border, right? This posterior border, it is directly in relation with this muscle. What is this muscle? Sternocleidomastoid. See here. This is sternocleidomastoid. Right? Posterior border in relation with the sternocleidomastoid. Still, if you wanted to write, you can write the posterior auricular vessel. But it's okay. If you don't write also, if you write sternocleidomastoid, that's sufficient. Here. Now, what are remaining? Surfaces are remaining. This is superficial surface and antero-medial surface, posterior-medial surface. Those relations we have to see. If you wanted to see the superficial surface, what we have done? We have removed the skin, we have removed superficial fascia. Within the superficial fascia, we have removed the platysma. This is platysma, right? We have removed the platysma muscle, right? Along with that, rhizorius muscle. Why? Rhizorius muscle is taking origin from the perotidomesenteric fascia. That means the fascia which is covering the parotid gland and also mesoderm. So when you remove that fascia, then only you can reach the gland. That's what perotidomesenteric fascia along with rhizorius muscle. Right? Then we have removed some lymph nodes over here. Those are superficial parotid lymph nodes. Superficial parotid lymph nodes. Then when you are removing the superficial fascia itself, we have removed one nerve which is crossing over the gland. What is that? Anterior branch of great auricular. It is not greater, it is great. Anterior division of or anterior branch of great auricular. Right? Then Perotidomesenteric fascia. These are the relations. Which relations? Superficial surface relations or lateral surface relations. Right? Now, then superficial fascia, then platysma rhizorius, okay, then anterior branch of great auricula, superficial parotid group of lymph nodes, perotidomesenteric fascia. These are the superficial surface relations. Then what surface is remaining here? This surface. Okay. What is this surface? Anteromedial surface. This is the anteromedial surface. If this is the anteromedial surface, what are the relations? Immediately anterior to this, what is this? Ramus of the mandible. Lateral to the ramus of the mandible, one muscle attached. What is that muscle? Lateral to the ramus of the mandible, masseter muscle is attached. Medially, there will be medial pterygoid muscle. So, anteromedial relations or anteromedial surface relations are posterior border of the ramus of the mandible, masseter muscle, medial pterygoid muscle. Along with that, in the upper part, it is in relation with the temporomandibular joint. Right? These are the relations. Recollect. Anteromedial surface related with the posterior border of the ramus of the mandible, masseter outside, medial pterygoid inside. Okay? Then temporomandibular joint. These are only relations. Then, which surface? This surface is posteromedial surface. This surface is posteromedial surface. Actually, from the posteromedial surface, this nerve is emerging, or this nerve is entering into this. This nerve is entering into the gland. What is nerve? Facial. This is facial. I think now it's clear. Right? This is the nerve, facial. That is one structure. Then, here, what is this process? Mastoid process. Why? How can you identify in the cadaver? See, this is sternocleidomastoid. Inserting to here. Sternocleidomastoid inserting to mastoid process. So here is the mastoid process. And here, what is this belly? Yeah, what is this belly? Posterior belly of digaster. This is the posterior belly of digaster. So, mastoid process and its attachments. Then, see here. Here is the bone. This bone is visible. It is stylus-like projection. Is it? So the stylus-like projection is what we are calling styloid process. So styloid process and its attachments. Then carotid sheath and its contents. See here. This is the internal jugular vein, vagus nerve, and internal carotid artery. These three structures are present within the carotid sheath. Right? Then last four cranial nerves. Of course, within that last four cranial, vagus is one that is present in the carotid sheath. Right? So, what are the different structures which are present in relation to the posteromedial surface? Means you have to say that in 4 sentences you have to complete. Mastoid process and its attachments, styloid process and its attachments, carotid sheath and its contents. Last 4 cranial nerves. Right? So, mastoid process and its attachments is sternocleidomastoid, posterior belly of digaster. Styloid process and its attachments is stylohyoid, styloglossus, stylopharyngeus. Right? Then carotid sheath and its contents is internal jugular vein, okay, vagus nerve, internal carotid artery. Then last 4 cranial nerves, 9, 10, 11, 12. 9, 10, 11, 12. These are the last 4 cranial nerves. Right? So these are the relations. Clear? Which surface? Posteromedial surface relations. Almost all structures we have seen. What else we left with? Blood supply and nerve supply and all we have discussed in theory. That's it.